Hi, I'm Chrissy Romelli. I'm the patient liaison here at StoneSprings Hospital Center for the Women's and Children's Services. Today I have with me Dr. Stephen Dillon from Anesthesia, and we're going to have a conversation about the most common questions asked by our patients about the anesthesia options they have here at StoneSprings during their special day, their baby's birthday. How long on average does it take for you to arrive once a patient decides that they would like an epidural placed?
From the moment a patient requests an epidural to the moment the nurse contacts our team in order for us to come upstairs to labor and delivery in order to provide an epidural, that takes on average about 10 to 15 minutes. Okay. Sometimes it takes a little less time, and on rare occasions it may take a little bit more time.
Great. And how long does an epidural last?
So an epidural will last as long as we keep an infusion in place. The way epidurals work is that a very, very small catheter is inserted in your back. It's hooked up to an infusion pump, and you get a constant infusion of medicine that goes at a constant rate all throughout the time that you're laboring with that epidural in place. As soon as you deliver your baby, we stop that epidural infusion, and from there it takes about 1 to 2 hours for the effect of the epidural to go away.
Okay, great. Patients do ask me on occasion if they'll be paralyzed from an epidural.
So the patient is not paralyzed when an epidural is in place. It is very, very common in order once the epidural is fully set up and you're feeling that numbness in your belly, for you to have a little bit of leg weakness. So your legs feel a little bit heavy. You are able to pick them up in bed, but you're not able to walk safely. So once you have the epidural, it is for your safety that we don't let you walk around your room.
Okay, great. I also get the question, is there a walking epidural?
Currently, we do not have a walking epidural protocol at StoneSprings.
Okay, perfect. Do we use laughing gas here at StoneSprings Hospital Center?
So before the COVID-19 pandemic, there was lots of discussion to offer nitrous oxide to our patients, managed by our obstetricians and our midwife team. Currently, during the COVID-19 pandemic, those plans have been shelved because nitrous oxide is considered an aerosolizing procedure and an unacceptable risk for spreading the virus.
So Dr. Dillon, some patients have expressed concern over the process of getting an epidural. Can you explain the process to them?
Absolutely. So once you request an epidural and once we respond to it, we have patients sit up in bed and kind of hunch over and make sure that they have really bad posture and stick their lower back out towards us. What we then do is clean your back off, place a sterile drape on to make sure that there's a sterile field while we perform the procedure. And we take a little local anesthetic or numbing medicine and we numb up the skin and soft tissue around where we're going to insert the epidural. This does sting a little bit, briefly, but then that stinging sensation goes away as the medicine takes effect. After we numb up the skin and soft tissue, we take a different specific epidural needle designed to find the epidural space. We go through the vertebral ligaments until we find that space, and then we thread that small catheter or small tube into that space, take the needle out over the tube, tape the tube up the back, and hook it up to our infusion.
Okay, perfect. And that's how the patient is delivered medication while the epidural's in, so the needle is gone.
Correct, yeah. There are no needles in the back while the epidural infusion is being
perfect.
delivered.
A patient asked if they're having a C-section, do you stay with them throughout the whole procedure?
So if a patient requires a C-section, you will always have either a physician anesthesiologist like myself or one of our qualified nurse anesthetists there with you 100% of the time during the entire time you're having a C-section.
Okay.
If you have a nurse anesthetist there present with you, a physician anesthesiologist is available during any critical portions of the case.
Patients want to know how long it is after they have their C-section before they can actually get up and get out of bed.
It depends on which modality is used for your C-section. There are 3 different ways that we can provide care to you while you have a C-section. The majority of the time, especially during elective C-sections, we'll provide what's called a spinal anesthetic. A spinal anesthetic is when we deliver medicine into the cavity that holds both the spinal nerves and your free-floating fluid containing those nerves called cerebrospinal fluid. What we do is we deliver medicine one time in that space, and that produces a very dense block that lasts about 2 hours, which is more than enough time to conduct the average C-section. Once you get back to the room after a spinal anesthetic, you're typically able to get up and walk around an hour and a half to 2 hours after you arrive to the room.
Can you briefly describe the 3 procedures that you do for a C-section patient and how they are affected afterwards?
Sure. So when you require a C-section, what we provide for you are 3 different modalities. One is we can use an existing labor epidural in order to provide numbness at the belly, or what we call surgical anesthesia, using that epidural. 2 is we can provide what's called a spinal anesthetic, which is the most common anesthetic that we use for elective C-sections. 3rd, in rare instances, especially during emergency situations, we may have to perform what's called a general anesthetic. This just means that the patient goes off to sleep and is completely out and completely unaware of anything that's going on. If we use an epidural, for example, an existing labor epidural, in order to perform your C-section, the epidural catheter is removed when the surgery is over, and the numbness goes away typically 1 to 2 hours after the catheter is removed. And once the numbness goes away, the patient is able to get up and walk around after that, and is in fact encouraged to get up and walk around after that. When a spinal anesthetic is placed, the spinals typically last about 2 hours. That is more than enough time in order to perform the average elective C-section. So when a patient comes back to the room, they're typically much more numb and much weaker in the legs than they would be had we used an epidural. That is perfectly fine. Typically we like for patients to wait also about an hour and a half to 2 hours before they walk around. We definitely want to make sure that the spinal has completely worn off, and the patient has the same amount of strength that they did before the spinal was placed. If we have to perform a general anesthetic for a patient, again, that just means they're completely out, completely unaware. There's a different procedure as to how we recover patients from a general anesthetic. Because we have to get them off to sleep, we need to make sure that their blood pressure is normalized, their heart rate is normalized, they're able to breathe as well as they did after the procedure as before the procedure, and that they're not over-sedated before we allow them to get up and walk around. And every patient is a little bit different, and that can be variable.
Someone have expressed concern to me over a phenomenon known as a window. Can you address that concern for us?
Absolutely. There are some rare occasions where we place an epidural and a patient will experience numbness on only one side of the body. That's what most people refer to when we say a patient has a window of pain that's breaking through. This comes from the epidural catheter only kind of curling up on one side of the epidural space rather than the other side, and the medicine not being able to spread to the other side. Sometimes we're able to pull back on the catheter and re-tape it in the back, and that solves the issue, and we're able to get adequate spread throughout all parts of the epidural space. But sometimes we're not able to get adequate spread, and during those times we need to pull the catheter and just replace it at a different level in order for patients to get comfortable.
So most commonly, patients generally ask you if getting an epidural can slow their labor. Can you address this concern?
I can, and that's a great question because our group hears that question all the time as well. And what I generally tell patients is that there have been many, many studies conducted investigating that very question. And if you take the effect of all of these studies, there's no credible evidence out there that suggests that epidurals will slow down the course of your labor. There's also no credible evidence out there to suggest that an epidural will increase your risk of progression to C-section.
Dr. Dillon, thank you for joining me today and helping quell fears that our patients have leading up to their birthday. Is there anything else you would like to add?
Well, I'd like to say we greatly appreciate the opportunity to answer all the most common questions that people may have, and that it's a real honor and privilege to be able to care for the pregnant patients in our community. If anybody has any questions during the delivery process about pain relief or options for pain relief that we can provide, they're free to talk to the on-call anesthesiologist anytime they want. And we're here to facilitate whatever your birth plan may dictate.
Thank you for joining us today. I hope this was very informative for you. And if you have any other questions about the Women's and Children's Services at StoneSprings Hospital Center, visit our website.